Good evening, wonderful viewers from wherever you're watching us from. It's always good to be back on this platform, and this is the one-to-one program coming to you on QTV on our studios on Caraba Avenue, and I am Julden Jai. Joining me this evening for this is Dr. Ahmadul Lamin Samate, the Minister of Health. Good evening, Mr. Samate, and welcome to the program.
Good evening, Julde. Thank you for having me.
And thank you for honoring our invitation once again.
Thanks.
We're going to talk about lots of health issues and, of course, the challenges that the health sector is confronted with. And of course, in the past year or so, we've been confronted with the COVID-19 pandemic, and you are a minister. How has it been for you actually managing this in the context of the COVID-19 pandemic?
Thank you very much, Julia. Of course, we all know the importance of the health sector. The health sector is a very important sector in all countries around the world, because for meaningful development, for socio-economic advancement, the health sector has to be robust in the sense that the people need to be healthy. Without a healthy population, you certainly cannot have the development you yearn for. People wouldn't be able to go to school and learn. People wouldn't be able to lead productive lives. Famine will be diminished, as it happened in other countries when they had global health challenges. So certainly it's very important to have our people being healthy. You know, the health sector, but certainly most health systems had a lot of challenges. Gambia is not left out in this. Now, in the Gambia, we inherited very difficult circumstances when His Excellency President Barrow's government came into office. I was a worker at the main teaching hospital. We had dilapidated infrastructure. We had times that we didn't have the basic equipment. We didn't have adequate number of monitors. We didn't have suction machines. Health workers would run between the theater and the wards to borrow a suction machine to ensure that a patient who was vomiting got the stuff sucked out so the patient does not aspirate and die. These are the kinds of circumstances we inherited. Now, when President Barrow's government came into office, we got the instructions to deal with the challenges of the health sector. And those instructions we took very seriously. By initially doing an assessment to get to know what the problems are. Now, we realized that there were dilapidated infrastructure, inadequate infrastructure. There were obsolete or absent equipment in some cases, and human capacity gaps were also there. And I'm sure the interview probably will take us to all those levels.
Absolutely.
But this is what we inherited. Now, before we could settle down to resolving these issues, the COVID-19 pandemic came. We came as a surprise to the global health systems, and I don't think any health system was actually ready for such a pandemic because it had never happened in our lifetimes. However, going back to the strategies we've been putting up with regards to dealing with other endemic diseases, the governments around the world were able to see the way forward. Gambia was not left alone. We built on the knowledge that we've had with regards to our preparedness to deal with outbreaks like measles, and even Ebola. So we looked at, we re-strategized, looked at what was there and what needed to be done. And in that process, we formed groups that comprise of experts in various aspects of dealing with medicines. Dealing with the pandemic per se. First of all, we had to diagnose COVID-19. And we didn't have a national diagnostic capacity initially. So in collaboration with the Medical Research Council, we were able to pick up the COVID-19 cases. But further down the line, we established our own diagnostic center at the National Public Health Laboratory. Initially, we were able to pick up the disease because that was very critical. Equally speaking, Gambia had been one of the countries initially where we are able to do genomic sequencing. Many countries couldn't do that. And that with the support of the MRC, collaborating with them, we were able to do genomic sequencing. Now, the response had to take place. the cases had to be picked, and people needed to be treated, and of course materials needed to be available. So the logistic bit was very hectic, getting the diagnostic kits, getting the medications, and then getting the team of health workers to come together to ensure that these patients got the best of care. Right. It was tedious because it was risky. That was the time that people were so afraid throughout the world. People were so worried, about themselves and their families, but the health workers were there, equally worrying about themselves and their families, but more so worrying about the general population. And then they had to go out, at great risk to themselves and their lives and that of their families to ensure that the people of the country get the best of care. So right. we cannot go for that, Julia, without appreciating the effort of the health workers. I think this is an opportunity to thank all the health workers for the sacrifice. Mm-hmm. We lost a few of them, and we remember them today. And may Allah grant them Al-Jannatul Firdaus, and for their families, to be given the strength to bear the loss. Okay,
right. You did mention when you were coming the challenges that you were confronted with when it comes to infrastructure and, of course, human capacity and equipment. And currently, as a country, as a health sector, what are the most pressing issues that we are confronted with? And what initiatives do you have to address them? Do we still have these issues as a challenge in the health sector?
So just as I said, access is very important, because people need to be given the best of healthcare wherever they live in this country. Now, to improve on access, under the instruction of the President, we are tackling the issues of the health sector in threefold. One of them is to increase access. By doing that, we are renovating and upgrading, and in some cases expanding the old health facilities to make them more habitable, to make them more patient-friendly, and where our staff can work in a good environment to be able to provide care to the best of their ability. And by so doing, you've seen the renovation work we are doing. Probably we'll be given the chance to enumerate them at some point further in the interview. But we are doing that. So we can see, for example, so that is improvement of the facilities, and constructing more so that health services are available at the doorsteps of the population. Now, with regards to increasing that access, we are renovating, upgrading Edward Francis Small Teaching Hospital. You've seen it, you've been seeing it. We are doing the same for the polyclinic in Banjul. And in Banjul, we equally, in collaboration with the Ministry of Higher Education, through the medical school, we are building a new school, a dental school in Banjul for the first time in the history of this country. Already there are students who are pursuing degrees in dentistry in the Gambia now. In addition to the medical school, we have that.
You mentioned some of the schools, like dental schools, and initiatives that you're doing, renovations of the Edward Francis Small Teaching Hospital, but I've not heard you mention in rural Gambia what the government has been doing as far as access to healthcare is concerned.
So what government is doing with regards to access, I think it might interest Gambians that as I speak to you, the government is constructing 6 new health facilities. 5 are almost, in fact, 5 are completed. They are waiting availability of, or the arrival of some equipment that we have procured through the support of the World Bank, and they'll be inaugurated in a couple of months. The 6th one is undergoing construction. These 5, one is in Tumanna, one in Kisimajau, one in Badibu Salikenya, one in Jali, one in Mankamankunda. There are 5 of them. And the 6th one is actually in Jau, Upper Salum, which is bigger than these others. So this is a big plus for the health sector. So by now, many Gambians already know that we are building a state-of-the-art emergency treatment center at Farato that is going to have 104 beds with a modern 20-bed intensive care unit for the first time in the history of this country. Equally speaking, it's going to have a modern imaging center that's going to have CT scanners, MRI, fluoroscopy equipment. Is equally going to have a new blood transfusion center for the country. Adjacent to it is also going to have a new National Public Health Laboratory. This construction is already ongoing with regards to this. Now, adjacent to this structure, we will soon start the construction of a biomedical engineering unit for the Ministry of Health. This had also never happened in this country. Because we are buying a lot of equipment and we want standard healthcare, for that reason, we need to have biomedical engineers and a unit that is responsible for the maintenance and the upkeep of all this equipment that we are procuring. Now, so you also probably remember that some 1 to 2 years ago, the President, His Excellency, had inaugurated 5 health posts, one in Brikama Nyambai, one Brikama Wellingara, one at Tampoto, one at Makumbaya, and the other one at Busumbala. This is all geared towards increasing access of the people, access to health services to the people of this country. Now, similar health posts will be built, about 13, 14 of them again. We working on the funding of that for those, and those will be built along the length and breadth of this country. Equally speaking, discussions are far advanced, and the designs have been done for a new hospital in Brikama. We've secured the land, and then a new hospital in Basse as well. These are all progressive things that are happening in the health sector, and as part of the plans now, with regards to health infrastructure, we want to build a new hospital in Combo South that is far advanced, the planning process. Now, in addition to that, we realize that when accidents happen along the length and breadth of the country, before people get access to health facilities, they usually would have suffered, some even die. So for that reason, along the length and of this country, both the South Bank and the North Bank, we have already done these designs. Inshallah, we'll be building ambulance sites where ambulances will be stationed on the highways, with a unique number that will be called, and they will rush to accident scenes. Along the highways too, when people travel, they do not have conveniences. And then people use the bush, which we don't want as a health sector, because we want zero opundification in the country. So we've already done the designs, and we're working on building areas on the highways called rest areas, where people will drive into, use the restrooms, rest. Drivers can stretch their legs and even drink a cup of coffee or tea on the highways in Gambia, both the northern and the southern highways. I think we are building about 13 of these structures. So these are all in high gear. Now, so all in all, we certainly are moving in the right direction in getting access to health facilities. Now, some of the old facilities, I'm sure we all know in the Gambia, asbestos used to be used as a roofing material. Now, with the support of the World Bank, about 13 facilities in the country that have asbestos will all be removed. No more asbestos on the roofs of the health facilities and the residences of our staff. These will be removed, and all those facilities will equally be renovated. And that process has already started. Okay.
There is no doubt that the Gambia health sector has made significant progress over the years, especially in terms of infrastructure, like you mentioned. And all these, the Gambia has plans to build 14 health centers across the country. But building hospitals and clinics is one thing. But the resources and, of course, the human personnel is another. What is the ministry doing? We know that there is a huge capacity gap as far as the health sector is concerned. It's no exception. It's just like other sectors. What is the ministry doing in that line in making sure that personnel are there and, of course, their capacities are boosted?
So that is the third, one of the 3 strategies and the instructions we got from His Excellency. The first is health infrastructure. But the second, of course, is which could be the third as well, whichever one comes first. But health sector work, you tend to do it all together. All 3 need to go together. But one is to get life-saving equipment for the people of this country. Now, I told you initially when I was a surgeon at the hospital before His Excellency government came in. Probably there's one suction machine, and that suction machine was in the theater. If a patient was on the ward and he was vomiting, and of course vomiting in unconscious people could kill. The staff, the nurses had to run to the theater to borrow that. Sometimes an operation would have been going on. So we said no, that cannot continue. So government itself has invested millions of dollars to procure brand new equipment. These are not things that used to happen in this country. But government has provided many millions to buy equipment for the health facilities, and those have been procured. Now, the partners seeing the efforts of government have come on board to ensure that these life-saving equipment are there. Julie, as I speak to you, I think what we have invested in equipment in the health sector from government and partners is over $1 billion. As I speak to you, last week I went to inspect brand new equipment procured by the World Bank to the tune of $2.5 million that is supposed to equip the new health facilities. So very soon we will see wonderful innovations and equipment in the health facilities in the provinces that the urban areas probably will be envious of. And this is what the rural people, rural dwellers in the country are also going to enjoy. Brand new monitors, wonderful equipment that some facilities in the combos don't even have. They are going to be in these health facilities. Now, but with this equipment and the structures, they have to be manned by people, competent people, skilled people. Now, of course, the equipment themselves have to be taken care of. So we said we need to invest in biomedical engineers and biomedical technicians so that this equipment, these national assets are taken good care of. That is why we are training some people. We've gotten some people trained, but we are building a new biomedical engineering center that's going to be funded by World Bank. Inshallah, soon the construction work will start.
So how many people are we talking about currently, the people that you're training?
We are training about 2 that are going to study biomedical engineering.
But is that enough, considering?
Of course it's not enough, but these are the resource constraints. You know, if we had the resources, we would train 10, 20 people so that each hospital has one biomedical engineer. But it's based on the availability of the scholarships. We already have 2 in country, but before we never had any. So now in the next few years, we're going to get 4 or so and training. So really more need to be trained. But when it comes to training, certainly that's very, very important, and government takes it very, very seriously. In the health sector, fortunately, we have a medical school. Now, we've been training doctors for quite some time in the country now. And, but these doctors also need to specialize, and that had been a big problem. Now, the specialization is important so that people of this country also get specialist care. We do not have to refer those people to patients outside this country. Now, this government, President Barrow's government, started a specialization training for doctors in this country for the first time. I think that's a big plus. It is phenomenal in the sense that these doctors now, in fact, some have become specialists, some have become members in certain faculties, and now it is continuing. So currently, as we speak, we have up to 30 young doctors, 30 or even more now, young doctors who have passed their primary exams and they started specialization process. Now these doctors will become specialists in this country. We didn't have that opportunity. We all had to go out to train to become specialists. But these young doctors will stay with their families at home, continue to provide services, and be trained free of charge. Now, so at the Edward Francis Small Teaching Hospital now, we are able to train doctors to become surgeons, general surgeons, pediatricians, internal medicine physicians, obstetricians and gynecologists, and family medicine specialists. And we are expanding this. Now, just to finish off with the specialization, we've equally have started building capacity of the nurses now. in that same regard for them to specialize. So now we have nurses specializing in pediatrics, in perioperative nursing, and equally speaking in nurse anesthesia, which is very important because we want to expand the cesarean section facilities in this country, which we have started doing. So we said for us to be able to do that, we have to train competent people to administer anesthesia. Anesthesia is one very critical area in the practice of medicine. So if you do not have competent people providing it, mortality could be high, perioperatively around the operation site. Right. So this is very important. And as I mentioned earlier, now we have a dental school. Gambia is training dentists right here in this country. I think that is a big plus, which we are doing in collaboration with the University of the Gambia. But just to cap that up, through the support of the World Bank, we have brought 16 very high-level professors and senior consultant doctors from Ghana and Nigeria. They are currently based here, and they are the ones helping, together with our local consultants, at training this crop of doctors to become fully fledged consultants, that means specialists, and also training the medical students. Now, we have also, in the same training issue, the School of State Enrolled Nurses in Bansang, and then the CHN school in Mansa Konko. We've expanded them. We've built more classrooms. In fact, we built a new school in Bansang through the support of the MRC Holland Foundation. There's a new school to train these people. Equally speaking, in Mansa Konko, we've expanded their school. Now the Mansa Konko school is going to get dormitories where they can get accommodation. So a lot is happening with regards to capacity building. So
again, capacity building, it's important. Training, having doctors and nurses to specialize is equally also important. But retention has always been a biggest challenge for the Gambia. Does the Ministry of Health has any strategy at all to retain these young doctors once they are qualified? Thank you.
I think that's very important, especially with the shortage of healthcare workers worldwide. So we need to be able to keep our own. First of all, there are various strategies. When you have people, of course, people are free to go for greener pastures, but people are also getting motivated to serve their people at home. Because sometimes we say if all the people, health workers, leave to other countries, who will take care of our brothers and sisters? I mean, we have come, Dr. Samote has come, all the other doctors and the nurses have also come. We've trained elsewhere. We decided to come back to serve our people. We are not saying, others should not be in other countries, but that also the motivation to serve our people, to provide for the people, and the mind that if we abandon our people, who will take care of them? I think we are inculcating that more in the young ones, that it is our responsibility, it is our duty to provide the services for the men, women, and children of this country. So we have to sit down here to do that. But of course, we will go. Those who decide to go, of course, as they continue to provide services to humanity, that's also good, but it's elsewhere. So, but we've improved. Some people go away not because of financial reasons, but because the working environment is also not conducive. They do not have the tools. That frustration.
Sometimes that's the reason.
So government is dealing with that. That's why we're making the working environment good for the staff. You know, hospitals need to look nice. They need to be clean. They need to get bright walls, bright light. The working environment, the aesthetics should be right. That alone motivates people, to work in those facilities. Of course, also the patients, it contributes to healing. When the mind is in such a place, it contributes to healing. So we are doing this. But importantly, also providing the equipment. When they have the tools, they will enjoy their jobs. They'll enjoy providing for their people, for the citizenry. Additionally, when they also have a career pathway, because most people want to eventually advance in their careers. So now that we are able to train doctors to specialize, I think that alone is a big plus, because that used to be the biggest frustration point, for young doctors. if they cannot specialize. 1 year, 2 years, they get more and more frustrated. But now they know they can become whatever they want to be, even become professors in this country, inshallah. The same for the nurses and other healthcare workers. So these have all contributed immensely to our ability to retain more of our staff here. But equally speaking, this government has invested with regards to provision of more allowances for the health sectors, more than what happened in the past. If you look at the allowance structures now for the health sector workers, it had never happened before, just to continue to motivate them. And of course, encouragement too. People sometimes also, it is not the money or the resources.
I just hope there won't be any more strikes by the health workers.
We hope there wouldn't be, because I don't think there'll be any need for any strike. Typically, there's hardly any need for a strike. I think most issues can be negotiated, especially when it comes to national issues, because the country belongs to us all. Whenever anyone goes on strike, it's ourselves who suffer, our people who suffer. But for patient care, my belief as a young professional, and it's still the same now, nothing will ever let me abandon that patient that I went to school to serve.
Okay. I know we'll go for a short commercial break shortly, but before then, earlier on you mentioned that you're working also on having ambulance sites. We know that government procured ambulances. In fact, last year we got around 80 plus ambulances in the country, and many critics of the government are saying that those ambulances are like white elephants if they have not been used, and some of them that are used are not even functional. How would you respond to that?
Of course, that statement by some people is not correct. I think sometimes because people have other ways of analyzing things, they think differently, they criticize things even when they know those in their hearts that those things are good. I think it is fair enough to say we don't like this government for A, B, and C reason. We don't like Dr. Samate, but let's be honest to say the good that Dr. Samate is doing and this government is doing. I think that's dignity. That's important. We may disagree. We may have different views when it comes to personalities, when it comes to politics, but let's say the truth where it is important. I think that's very, very important. How can an ambulance be bad for any system? And we know the people who are entering those ambulances. And the issue about ambulance is that we do not know who probably will need that ambulance. It could be even the health minister or a relative of his, or anybody or any person. So we drive in cars, and then those ambulances may be parked where there is a problem. We all pray that we are not the ones using them for ourselves, but so some of those things are inevitable as human beings, isn't it? So those ambulances have been remarkable for the communities. It is amazing to know the kind of joy that comes to the faces of those people. Sometimes those who complain because they are not in the hinterland, they are in Kombu and maybe they have their own private vehicles. But for communities whereby they carry a pregnant woman on a donkey cart, for communities where they carry a pregnant woman on a motorbike, and these are realities. I went to Kerardo on trek one day. They were narrating that a pregnant woman was in labor. She was supposed to be taken to a health facility, I think Kerewan, and they were on a donkey cart at night with a traditional birth attendant, the woman on the donkey cart. As they got into the bush, they got attacked by wolves. And the wolves were crisscrossing their path. They had to go back. They had to retreat. And the woman ended up delivering at home in labor. Now, if you have a brand new fully air-conditioned Toyota Desert Land Cruiser in Kerardo, and there is one now, where that woman could enter to go to hospital in dignity any time of the day. Can that ever be a waste? And this is what we have across the length and breadth of the country, and we are going to buy more through the partner support. Partners have promised. We're expecting 11 more that will come very soon.
All those ambulances, are they all operational?
They're operational.
All of them?
They are all operational.
Okay.
Of course, every now and then they also need to go for maintenance, but they're operational.
Okay. With that, we will go for a short commercial break. When we return, the program continues. Don't go away.
Being the Gambia's trusted network, QCell continues to provide the fastest and most reliable internet service in the Gambia. With 4G plus internet speed, you are guaranteed fast and reliable internet anytime, anywhere with QCell. Get a QCell SIM card now at any of our customer care centers and enjoy the fastest 4G internet in the Gambia. For more information, call our customer care on 111. QCell, Sunyabus, we innovate, others follow.
Welcome back. If you're just tuning in, this is the one-to-one program coming to you on QTV, and I am your host, Julden Jai. Joining me this evening is the Minister of Health, Dr. Ahmadu Lamin Samate. And of course, we were talking about some of the achievements that he has registered and the initiatives that the government has rolled out and is rolling out in making sure that Gambia has quality healthcare delivery. You were talking about the ambulances and the fact that all of them are operational. So now let's focus on the issue of the public health. What is government doing in promoting public health? And of course, this is prevention in the country. We know that their role is very important.
Yeah, thank you very much. Julia, with regards to the ambulances too, with support of the German government, we'll soon be, inshallah, establishing an ambulance command site for the whole of this country. Funds are available for that, and we're looking at the technical details. So that site, they will be there 24 hours. When people need ambulance services, they will call, and those ambulances will be equipped with GPS systems so that they can even track the movement of these ambulances. Again, with the support of the German government in our public health interventions as well. They are also going to support us. They have designed our new teaching hospital at Farato. You know, we are doing components. Now, the whole design is now ready, and they are going to fund part of that. In funding part of that, we're going to, inshallah, through their funding, getting a new multi-purpose theater where, inshallah, soon we'll be doing kidney transplantation in this country, and also open heart surgery, so that we can operate open the chest of people who have heart disease and open their hearts to put in valves and so on and so forth. Inshallah, we'll be starting those here soon. These are all geared towards public health interventions. Of course, public health itself is very wide, apart from the traditional thoughts about public health, but all these things are public health issues. Now, when it comes to general public health disease prevention and control issues, a lot has been done. Now, our public health directorate has been strengthened, and the team has been very, very, very active. From border surveillance, the border control has been strengthened so that diseases don't come across the border to reach our shores. So we have the public health officers posted at the borders, and they are trained. They are trained to detect many of these diseases so that the people who have them are quarantined before they spread in the country.
So it is also believed that malaria is one of the diseases that affect people, especially during the rainy season. And we had that the Ministry of Health is working on rolling out a malaria vaccine campaign. How far are you going with that?
Thank you very much. So malaria itself, of course, is very deadly, especially for children and also pregnant women, and to anyone who gets the severe form of malaria. But the Gambia has made tremendous progress with regards to controlling malaria. In fact, as I speak to you, we are at pre-eradication level for malaria in the country. And, but of course, to be able to eradicate malaria, because we share a very close-knit kind of setup with Senegal, and some of our communities are along the border. For that reason, we are even doing synchronous health interventions, because if you eradicate malaria in Gambia and the border communities in Senegal still have, it will still get here. So we are working very closely towards them. But a lot of strategies are going on. As part of our vector control strategies, you know, we carry out fogging It will please you to know that Gambia now has 3 fogging machines. These machines could be mounted on vehicles and they go to spread the communities. These control the vectors. We used to see that in Banjul when we were kids, but we brought those back and we have procured 3 with the support of the partners. We also doing what we call indoor residual spraying. Our team members go into the communities and then they spray the household, the homes.
Have they started that?
Oh, they've been doing that yearly.
Okay.
So they do that. It is routine, mandatory nationwide. Okay. And distribution of insecticide impregnated bed nets. So at this juncture, we appeal to people to use bed nets. You know, bed nets were not recently are not thought to be stylish. People think it's not stylish.
That's the issue with them.
But it is useful. It protects us against malaria, and especially for children and pregnant women. And so we encourage people to use. Women should use, because if women use it in the house, everybody will use, because you take care of the houses, the household. So I think it's very critical. Now, of course, there is seasonal malaria chemo prevention as well. Children under 5 are given malaria chemo prophylaxis, and pregnant women are equally given malaria prophylaxis. So these have been public health strategies used in the control of malaria. We know about the vaccine, and our team is engaged. We carrying out the regulatory frameworks. The country has to, it's available for us in the sense that we've spoken to partners, but we are doing the approvals now. Because before you bring any new thing into the country, government itself has to approve, and the partners, government's partners, the stakeholders have to approve, you know, the introduction of such. So very soon, inshallah, we'll have malaria vaccine in country. Speaking
of vaccines, we know that there is a lot of vaccine hesitancy in this country. Key example of that is the COVID-19 vaccination that has been very low. What will the Ministry of Health do in terms of sensitization to make sure that people really understand the importance of these vaccines?
Thank you very much. I think some of the challenges we have with vaccination has been the poor publicity. COVID-19 was surrounded by a lot of bad publicity, and unfortunately, the messages on the social media did not help. You know, the typical vaccine hesitant people. Politics also entered COVID-19 vaccination. Sentiments entered it, and so on and so forth. But I think vaccination, we know, has been very useful. Gambia has been a pioneer. We have been one of the most successful countries when it comes to vaccination against the childhood killer diseases. Gambia has been commended worldwide for that. And the mothers in Gambia, they are very much aware, and the people of the benefits of vaccination. So we will leverage on the same. Sensitization is very important. So we hope that there will be a lot of health education when it comes to vaccination for people who need to be vaccinated against malaria. So sensitization, because people have to know that the benefits outweigh the risk, and with that they will come on board. And the good thing is other countries have already implemented, they have piloted these things, and hopefully Gambians will also not hesitate.
Okay. Let's now shift to mental health. We know that mental health is very important in terms of well-being. What is the government doing in making sure that it is a priority for the people with mental health? Because we know that we all have only one psychiatric hospital in the Gambia, which is the Tanka. You also mentioned lots of government initiatives, 14 health centers, making sure that you come up with equipment. But you have not mentioned the issue of Tanka. What are we expecting as far as mental health is concerned?
Yeah, thank you very much. I think the issue of mental health is as important as any other health problem. Unfortunately, generally speaking, mental health doesn't occupy the forefront as other diseases. So to say, it's an area that is typically neglected, but it's not neglected by our ministry, by our government. A lot of efforts have been put in place. As we speak to you, we're working on revising the policy documents, the Mental Health Act, that hopefully will come into being. It's that the proposed the draft bill is being looked at by government, and then it will be presented to the National Assembly in the very near future, because that regulatory framework is very important for us, for people to feel obligated, for people to feel mandated to treat mental health issues the way they are supposed to be treated. Now, mental health issues are on the rise. As countries develop, the stress factors increase, even in the urban settings with a lot of issues. Even the social media tends to contribute to mental health issues for some people because of what they see, because of what they hear, because of the abuses and the attacks people get from the social media. So mental health crisis is on the rise worldwide, but Gambia are not left behind. But I think another issue contributing to the rise in mental health issues is the use of the abuse of drugs by our youths in the country. We've seen the rise on the intake of these intoxicants that have been very, very detrimental. The majority of the youth we have in the psychiatric hospital are drug-related. That's a sad reality. So I think mental health, just as other health issues, the preventive aspect is equally important. People need to try to prevent these mental health issues. Let's try to teach the youths. Let's support them. Let's discourage them from these vices. But equally speaking, we try to get them out of harm's way by letting them get engaged in skilled work, and agriculture, in carpentry, and also further education. But I think this is very important, and it's every person, every parent's responsibility, and every citizen's responsibility to ensure that our youth are prevented from taking in these intoxicants, because it's contributing a whole lot to the mental health challenges. Now, the psychiatric hospital itself happens to be the only one, but we have community mental health strategies. Each region now has a mental health personnel that deals with the mental health issues in the health region, and the health facilities also have mental health nurses to ensure that we decentralize. So what we hope to do is to have regular mobile mental health clinics where doctors and nurses and other healthcare providers can go into the communities to treat the mental health cases. The psychiatric hospital in Tanka is the only one. We hope to improve on it.
And it's dilapidated.
Yes, so it's part of our strategies to improve. We hope to improve it, on it, and we equally hope to improve on the its specialization areas, because mental health itself has specialized areas where you can categorize, and then provide special facilities for the people who are there. But as a country, apart from improvement on the services, we are training people. One of our members of staff over there returned from Turkey from doing a master's degree. We are training our only Gambian that I know of being trained to become a psychiatrist. He's already been sent under sponsorship to be trained. When he finishes, he'll come back to support the facility. So that is also important, training the mental health personnel. But one thing we think we need as a country, and we're talking to partners to support us in that, is also a rehabilitation center. Because some people at certain points probably do not need to be in the psychiatric hospital. They rather be in a rehabilitation center where they can have, they can be rehabilitated to go back into the communities, to reintegrate. So there is a partner, that we've started engaging, and hopefully we will get that.
So currently, as we speak, the government or the ministry has no plan in building another psychiatric hospital in the country.
So we no plan as I speak.
Okay.
But we want to...
Then how serious are we as a country in addressing the issue of mental health?
No, but it's not the issue of just building facilities and not getting the skilled workers, as you said. So we want to make sure that the one we have is fully equipped and fully functional. If it is fully equipped and fully functional, I think we'll be able to deal with the issues. Now, but I think what we need probably now as a country is a rehabilitation center. But we have outreach centers in the country where mental health professionals go there to treat the people in the community. But in the near future, it's something that because we as a government, we want to decentralize. We don't believe that people should come all the way from the provinces to Kombo, and they also leave their families in the provinces and they come and stay with relatives here to get health services. We want to shy away from that. We want to revert that. We want to make sure that most of what is possible in the Kombos is possible up country. So eventually we will, but not immediately.
So in terms of response, we know that over the years we've heard lots of healthcare emergencies around the world, and the Gambia is no exception. What are you doing in terms of response as far as health emergencies are concerned?
Yeah. First of all, for health emergencies, we've all learned a lot from the COVID-19 pandemic. We have to have robust surveillance structures because you only deal with something when you pick it up. If you can't pick it up, then you may deal with it late. We want to have robust emergency alert systems, surveillance systems. So first of all, we are training people to understand more and more with regards to what surveillance is. Now, Gambia, we are training people in field epidemiology. There is a field epidemiology training program supported by partners, and we have people all the way to intermediate level. We are training all healthcare workers in picking up diseases. Health facilities have surveillance, officers, and they transmit the information they get. We have surveillance officers at the borders. But importantly, we are working with partners to develop an electronic surveillance system so that information will be shared real time and we pick up. But yes, surveillance is one thing, but when you pick it up, what do you do? So it is intertwined with having a good health system. If you pick a disease, to contain it, you may have to quarantine that person. You'll also have to treat that person, and you need an emergency treatment center. So that is why we are building this emergency treatment facility in Farato. But it's important to know that as part of the COVID-19 response, we have 3 temporary emergency treatment centers which could last up to 15 years in the country, and we are building another 8 emergency treatment centers across the length and breadth of this country. Construction work is going on with that. Those are for COVID-19 and related diseases or similar diseases. Now, where
are the resources coming from? You mentioned that you are constructing a lot of things and you have plans for lots of things, but where is the resources coming from?
So I think, Julia, what has happened over the years, government has been very committed. The resources from those for those facilities, COVID-19 facilities, the temporary sites came from partners. The one for the COVID-19 treatment centers came from the famous COVID-19 500 million that people were talking about. It was being used for COVID-19 response, so it came from those. But I think what has happened has been unprecedented in the health sector. I think they've seen government commitment, and government's readiness. Government is committing resources, but the partners have sensed something. That is, they've seen increasing accountability and transparency, zero tolerance for corruption in the health sector, and that is encouraging them. That's why they are coming on board with millions and millions of dollars to support, because they've seen the control measures we've put in place. When it comes to zero tolerance, we have now said to them, our people, we stopped people getting, big cash impressed to go, and health workers carrying money in bags to go to the provinces to pay. We say health workers are not paymasters, they are not accountants. Let's focus on health work. So now the payment structure we have inculcated in the Ministry of Health is each person who is supposed to be paid anything in Basse, he will provide his account number to the project coordination unit, and all those monies are transferred through the central bank. So the leakages are closed, and that is encouraging. Of course, the partners are confident, but that makes people make a lot of noise against Dr. Samate every now and then, because certainly few people will not be happy with these control measures. But this has earned us a lot of respect in the eyes of partners. That is why they are bringing in all these resources. Quite a lot of what I spoke to you is sponsored, is supported by partners. The hospital in Brikama, the new one, the one in Basse and Farato, partners have spent over $20 million US. Government contributed $2 million, and a host of this. But I think one important thing is we need to mention. With the support of World Bank, we have one of the best health waste care management tools in the whole of Africa. We have an eco-sterile machine, 250 at Farato, for clinical waste from hospitals. We have one eco-sterile 75 at Edward Francis Small Teaching Hospital. We recently bought 7 big containerized incinerators for the 7 health regions of the country. We have recently, they are installing, as I speak to you, 40 incinerators for 40 health facilities in this country. Because we don't want these syringes and needles and this cotton wool and all these things from hospitals to be thrown into the communities, contaminating the water bodies. Children go to play there. So Gambia has achieved a whole lot when it comes to this. Well, Julia, we cannot go further without talking about the oxygen plants in this country.
Exactly. Before you go there, you mentioned a very important point, which is the waste management. But I can bet that even if I go right now to the Edward Francis Small Teaching Hospital, you will see waste everywhere. How have you been utilizing that?
I think you'll be surprised. Maybe it's changed now. But I think...
I don't think so, Honorable Minister. Trust me, right now, if you send someone there, you will see waste everywhere.
You know, so probably that will be an attitudinal issue, because government can provide materials, partners can provide materials. But I don't think it's Dr. Samate's direct responsibility to ensure that a toilet in a hospital is clean. I don't think it's my direct responsibility to ensure that people empty waste bins. So everybody has to do play his role. I think when we all do what we are supposed to do, the minister does what he has to do, the directors do what they are supposed to do, the heads of the hospitals do what they are supposed to do, the workers in the hospitals do what they are supposed to do, we'll have a beautiful country. Everybody has to play his role. And we have to, after all, we are employed to provide these services. We should do what we are paid for, you know, to justify that. So I think, you know, everybody needs to do his work so that we can have. But it is phenomenal, because before now, all this waste used to be dumped at the normal dump sites, which was very dangerous. Birds will come and pick them up. Kids would go to play there. And then when it rains, this hospital waste used to be washed into the water bodies, very risky. But we are dealing with it as a country. I think it's one of the best in Africa with regards to waste management. And we have 4 refrigerated waste trucks, because we don't even want the trucks to be carrying this waste from health facilities and the wind is blowing it along the highway. So the trucks are covered and refrigerated so that they do not even ferment. So these are phenomenal successes in the health sector. We all know the challenges, the shortage of oxygen throughout the world when COVID struck. So as a country, we said, yes, COVID-19 came, but the resources the country is going to get or has gotten from COVID-19 pandemic should be put to very good use to ensure that we build a strong health system. And equally speaking, to deal with COVID-19, to deal with any further public health emergencies, but also to deal with the normal day-to-day cases that we see in the health facilities. So as I speak to you, as a country, we have 4 brand new oxygen plants generating oxygen for Edward Francis Small Teaching Hospital at Ndeban. And there's one big one also at Ndeban. There are 2, and one of them is even a double machine. That even one part is faulty, the other part can operate. So in fact, it's as if we have 3 in Edward Francis Small at Ndeban. Edward Francis Small Teaching Hospital in Banjul itself has 1. And there is one for Bansang Hospital, because we want to decentralize. So oxygen, and this is medical oxygen. I think also one of the best, you know, with regards to our public health preparedness. Oxygen is needed for operations, is needed for very sick patients. So this is a big plus. And now we also said we don't want oxygen cylinders to be carried, you know, to be pushed around the hospitals. So we now said we should ensure that oxygen is piped. So from these machines, there is a piping system they are going to install in Edward Francis Small Teaching Hospital very soon. In fact, funds are available for that. The contract has been awarded. They are going to pipe, so we are now going to have piped oxygen. From the plant, is going to go through the pipes to the wards, direct to the patients. So this is a big plus. And part of our response too, Julia, we've forgotten that we have renovated, expanded, and improved on Deban Health Facility. Now it's benefiting the people of this country.
Okay. Speaking of, let's now shift our attention to traditional medicine. Of course, we know that time it's not on our side, but it's very important. What is the government doing in integrating traditional medicine and the conventional medicine?
Yeah, so certainly traditional medicine is very important. It's a very important part of our culture. And, you know, so it is part of the health-seeking targets of populations in Africa and the rest of the world, really. And we know traditional medicine practitioners exist, and they will continue to practice traditional medicine. And as a ministry, we have a traditional medicines unit. It is under the Directorate of Health Services. So there is a dedicated unit that is there for traditional medicine. The challenge we have with traditional medicine is that standardization is a problem. But we are working with partners. West African Health Organization is supporting. And then the Traditional Medicine Assembly we have a group. They have an assembly in Gambia. In fact, I met with them last week so that we harmonize traditional medicine practice in the country. So first of all, we are trying to put forward the various laws that guide the practice of traditional medicine, so that the practitioners also abide by some rules and regulations that guides their practice to make it safe for the people. But the government is very serious about engaging them, is serious about ensuring that they are able to practice with some form of standardization and you know, abiding by the rules. And there's going to be an authority that's also going to observe the practice of traditional medicine. So we do not have all these adverts on TV that are doubtful in some cases.
Yes. Thank you very much. I'm afraid that's all we got time for. We would love to delve into so many issues, but time is not on our side. Thank you very much, Dr. Samate. That was Dr. Ahmadulamin Samate, the Minister of Health. And we were talking about lots of issues and the initiatives, programs, and the policies that the government or the Ministry of Health has in place for the Gambia in attending the SDGs on health. Thank you very much, viewers. Until we come your way next week for another episode of the One-to-One program, I was your host, Julden Jai, and do have a pleasant evening.